Aphasia is an impairment in language, which includes speaking, reading, and writing. And this could affect the comprehension, which is the understanding of language, the fluency, which is the ability to produce language, and lastly, repetition. Let's go over some basic rules. There are three important structures in the brain that control language. First, we have Wernicke's area, which is located in the temporal lobe. And the way to remember its function is to remember that the temporal lobes are close to the ears. So this area will receive language, and it's involved in the understanding and comprehension. And damage to Wernicke's area will result in word salad speech. So the patient wouldn't be able to understand what's said to them, and they would speak anything. And moreover, they wouldn't be aware of what they are saying, and this will result in word salad speech. Next, we have Broca's area, which is in the frontal lobe. And recall that the frontal lobe has the motor function, and hence Broca's area will be involved in the production of language, or the fluency. And damage to Broca's area will result in broken language, and the patient will be frustrated because they don't understand what they are saying. Lastly, we have some fibers that connect Wernicke's and Broca's area, and we call them the arcuate fasciculus, and hence its function is conduction. Lastly, we need all of these three structures for repetition, and the way to remember that is to draw a repetition sign across these three structures. Let's move to disorders. First, we have Wernicke's aphasia, which is damage to Wernicke's area. Wernicke's area is important for comprehension, and hence comprehension will be impaired. Since Broca's area is intact, fluency will be intact. And lastly, since one of the three structures for repetition is affected, repetition will be affected. Next, we have Broca's aphasia, which is damage to Broca's area. Since Wernicke's area is intact, comprehension will be intact. And since Broca's area is the area that produces language, the fluency will be impaired. And lastly, we have affected one of the three structures for repetition, so repetition will be affected. Next, we have conductive aphasia, which affects the conduction structure, which is the arcuate fasciculus. Since Wernicke's and Broca's areas are intact, comprehension and fluency will be intact. And lastly, we have affected one of the three structures for repetition, so repetition will be affected. Next, we have global aphasia, which affects all of the three structures, Broca's, Wernicke's, and the arcuate fasciculus. So all of the three functions will be impaired. Next, we have transcortical sensory aphasia, which affects the area around Wernicke's, but Wernicke's remains intact. So the input to Wernicke's area is disrupted, and hence it wouldn't receive any information, so the comprehension will be affected. And since Broca's area is intact, fluency will be intact. And lastly, since the three structures for repetition, Wernicke's, the arcuate fasciculus, and Broca's, are intact, repetition will be intact. Next, we have transcortical motor aphasia, which affects the area around Broca's, so the output from Broca's area will be affected, but Broca's itself remains intact, and this will affect the fluency. And since Wernicke's area is intact, comprehension is intact. As we said, the output from Broca's is disrupted, and hence the fluency is affected. Lastly, because the three structures for repetition are intact, repetition will be intact. Lastly, we have transcortical mixed aphasia, which affects the watershed area around the three structures. So this will affect the input to Wernicke's and the output from Broca's, and this will result in impairment in comprehension and fluency. Lastly, because the three structures for repetition are intact, repetition will be intact.